Hello, you're welcome to today's episode of Ask Dr. Ken. The question is, how do you monitor an IVF treatment cycle? You may have gone through an IVF treatment before, and I suppose you are monitored. You may be intending to go through one, but how do you think you'll be monitored? There are basic parameters that have been monitored during an IVF treatment cycle, and there are tools used for monitoring. The ultrasound scan just next to me is one important tool in monitoring an IVF treatment cycle. Also, the availability of a proficient laboratory is important in the monitoring of an IVF treatment cycle. During the first phase of treatment, the downregulation, the ultrasound is used to monitor or to visualize the level of thinness of the lining of the womb. And usually it's assumed to be okay when it is 5 or less than 5 millimeters of thickness. Then the quiet nature of the ovaries is also seen by ultrasound, and it is an indication of good downregulation. Occasionally cysts may be seen, and this can be treated as the IVF treatment goes on. The ultrasound can be used to monitor the rate of growth of the follicles and the sizes or diameter of the follicles, because with the aid of the ultrasound, the size of the follicle can be told, and the sizes at which specific decisions, like decision to trigger the stimulation, will be taken. For instance, most triggers are administered when the diameters of the follicles are between 17 to 18 millimeters. The thickness of the lining of the womb during stimulation is also monitored with the ultrasound, as pregnancies are seen to occur more when the thickness is above 7 millimeters. Decision for an IVF treatment to be cancelled may be taken based on the lack of response or poor growth of the endometrium. More recently, the use of Doppler ultrasound is being encouraged because for some special cases, the diameter of the follicle may not really be in keeping with the size of maturity for taking decision for trigger. Doppler ultrasound scan showing the peak flow velocity of the blood flow around the follicle could also be used in deciding when to administer the trigger medication. The Doppler ultrasound also of the lining of the uterus can be used in determining which endometrium or lining of the uterus is likely going to be friendly for implantation, because grade 2 to grade 3 of blood flow of the endometrium as seen with the Doppler ultrasound can be a very important index for implantation. Biochemical parameters are also used in monitoring of an IVF treatment cycle. For example, the estradiol level in the mid-cycle during the stimulation can show the risk of ovarian hyperstimulation syndrome, and that can help in limiting or restricting the amount of medication that is being administered. That can also be helping controlling the risk of having ovarian hyperstimulation syndrome. After the oocyte retrieval, there are a series of monitoring that also occur in the laboratory, and this monitoring is done on the embryos themselves. The rate of fertilization, the timing of fertilization is also monitored The degree of division and fragmentation is also monitored, and this helps in deciding which embryo needs to be transferred back to the uterus. Monitoring of the environmental condition of the incubator or the laboratory parameters is also important in achieving success in an IVF treatment cycle, since it is aimed at having environmental conditions similar to what is obtainable within the physiology of the human body. The IVF treatment cycle is a very sensitive cycle and requires a high degree of monitoring to achieve success. The number of oocytes being developed or being generated could be monitored with ultrasound scan, as the number could be indicative of the likelihood of developing ovarian hyperstimulation syndrome, in which case the amount of pain a woman is having, the presence of swelling of the lower abdomen or bloating generally could also be monitored clinically. In summary, the IVF treatment cycle can be monitored using the ultrasound and the laboratory parameters, and also the clinical status of the patient that is being treated. You can get more information from our website www.albshospitals.com, or even subscribe to this YouTube channel. Until I come your way next time, I'm Kenneth Iguda, your consultant gynecologist and an IVF specialist. Thank you.